Now let's see second degree AV block.
This is the ECG. We are showing the normal ECG, first degree AV block, second degree AV block and third degree AV block. Here, understanding second degree AV block, the ECG findings are progressively lengthening of PR interval. See here, PR interval get prolonged and which is followed by dropped QRS. QRS complex get absent or dropped or eventually missed. This is called a second degree AV block, and pattern is about the PR interval gets shortened after the dropped beat. Once a PR interval gets shortened after the dropped QRS, there is an absence of QRS will next followed by PR interval is gets shortened, and the significance also shown here.
And it consists of two types, Mobitz type 1 and Mobitz type 2. Mobitz type 1 or Wenckebach block, it is defined as a second degree AV block in which there is a progressive PR prolongation interval until a beat is dropped. And this is caused due to increased vagal tone, inferior valve myocardial infarction, and the drugs are beta blockers, calcium channel blockers, digoxin and myocarditis or due to electrolyte imbalance. And the ECG criteria we observe right here are gradually increased PR interval. That is, like, we can basically observe the PR interval is prolonged progressively in each cycle, and then the cycle basically repeats, and then the shortest PR after the drop beat.
So here we understand that PR interval get prolonged progressively. See here, if it is 0.27 means here it is about 0.30, 35, and next is followed by progressively get prolonged in PR interval, which resembles Mobitz type 1 HeartBlock. Then another things are
Mobitz type 2, and it's basically defined as a second degree AV block where sudden drop QRS complexes occur without any PR prolongation.
So here we want to understand one thing, there is no PR prolongation, but the important is the QRS get skipped, which means dropped out. There is no presence or occurrence of QRS. P wave is there, but there is no QRS. So skipping or skip the absence of QRS will happen in Mobitz type 2 degree HeartBlock.
Okay. And the causes of Mobitz type 2 are anterior valve myocardial infarction, degenerative conduction system disease, structural heart disease, post-cardiac surgery, severe ischemia.
Or if it is maybe also occur in post-cardiac surgery, which resembles CABG or valvular replacement, or pericardiocentesis like any patch closure at all, which may occurs. Okay, next ECG criteria.
The changes we observe in ECG are constant PR interval, sudden drop QRS complex, may show fixed ratios, often associated with wide QRS.
Wide QRS. Maybe QRS, at presence of QRS, anything may be due to wider. Fine. Next.
And let's see the clinical manifestations. That is a syncope, dizziness, fatigue, dyspnea.
So these skipped beat may be due to which cause the conduction of ventricle get delayed. No, absence in for a few seconds, which one cardiac cycle gets skipping. So there is no output for a certain fraction of second. If we want to eject, the ventricle want to eject 60% means that skipped beat which resembles there is no output. So which will cause the dizziness, syncope, or sometimes it may be cause sudden arrest also eventually. Okay.
Let's also see the quick differentiation table between the Mobitz type 1 and type 2. In the PR interval, there is a progressive prolongation in Mobitz type 1 and constant in Mobitz type 2. And then the drop beat, it is pretty much predictable in the Mobitz type 1 and it's all of a sudden in the Mobitz type 2. And in the site of block, we see AV node block in the type 1 and the bundle of His
in Mobitz
type 2. And the severity would be mild in the Mobitz type 1 and serious in the Mobitz type 2.
Yeah, if it is due to skipping of QRS, no, there is no conduction in for fraction of second, will quit or absence of cardiac output, no, which will cause the enough or demand of oxygen supply to the brain or whatever. So it is a serious condition absolutely. Next.
And symptoms would be minimal for the Mobitz type 1 and severe for the Mobitz type 2.
Sure, okay.
And the
treatment is
usually there is there is no treatment for the type 1, and the type 2 has the pacemaker.
Okay. Initially we planned for pacemaker, but later if it is sometimes drug also may be complemented, or if it is does not means we will move another thing, pacemaker. Okay.